My name is Wilfred Ehrmantraut Jr., and I am a plastic surgeon and current Chief of Staff at Calvert Hospital. I went to University of Maryland, come from a long line of family who was educated at University of Maryland, and then went to George Washington University Medical School. After I completed my training, I was a resident in general surgery, completed 5 years at St. Agnes Hospital, and did rotations for University of Maryland Shock Trauma, and Johns Hopkins. After I completed the 5 years there, I went on to training at Penn State, Hershey, and completed 2 years of plastic surgery fellowship. I decided to become a doctor and surgeon basically at the same point. I was at University of Maryland completing my anthropology training and was doing rotations through forensic anthropology and forensic medicine. Part of my rotations were at Smithsonian Institute, and part of that involved reconstruction of skeletal remains. And during that period of time, I had increasingly interest in biology and decided to pursue training in medicine. And that drove me to medical school, and during my medical school training, one of the rotations that put everything together for me was plastic surgery. And I was able to shape and mold body parts that were destroyed by various traumas or accidents or pathology. So I'm passionate about plastic surgery for several aspects. It's a dynamic field, changing quickly, and we're having a lot of advances and able to recreate patients' body parts, form and function. And there is a lot of research continuously going into the field, and it's increasingly become more interesting because of that. So my approach to patient care is individualized with each patient. Each patient is very unique and has very unique issues that need to be addressed. We are continuously improving. We learn from each one of our patients every single day. It is probably the best education, treating each patient individually, and we're advancing because of that. And Calvert Health has allowed us to not stereotype a patient, but offer an individual treatment to each person. So it's an honor to treat patients. When they come through the door, it's like a family member, and oftentimes patients are scared, and we offer them not only the ability to treat them, but also the ability to care for them as a human being.